Thanks, beYogi, for hosting me today. And thank you all so much for taking time and caring to learn about adapting yoga for pregnancy. I'd love to learn if you can put it in the chat if you're a yoga teacher. Um, and if you're pregnant right now, or maybe you're trying to get pregnant, if you want to share that in the chat, if you feel comfortable. Oh my gosh, yes to both. Just starting. Amazing. Yeah, it's good for me to hear because this workshop, this webinar today is wonderful for both yoga teachers. Nice. Oh, and someone who works with doulas. Now all the answers are trickling in. Awesome. Oh, congratulations, Leslie. Nice. A grandmother. Awesome. Yes, yes. Oh, Katie, sending you positive vibes with that. Allie, good to have you here. Welcome, welcome. I'm seeing some familiar. Allison, nice. Oh my goodness. What a treat to be here with you all. Thanks for sharing. Um, well, this training is wonderful whether you're a yoga teacher or whether you're a pregnant yoga practitioner and you want to learn some simple, empowering modifications to best support your practice. Like Lizzie mentioned, I teach both vinyasa yoga. I've been teaching full time as a yoga instructor since 2006, so for about 16 years. And I'm also a mom. I have two boys and a prenatal yoga teacher and a prenatal yoga teacher trainer. So I run a 100% virtual Yoga Alliance registered prenatal yoga school. It's called Home Yoga Online Prenatal Yoga Teacher Training. And we have trainings once a year. The next training starts in December. And like Lizzie mentioned, we'll be sharing with everyone who attends or catches the replay of this webinar a special $100 coupon code that you can use to enroll. And if you apply before November 1st, you can combine that with my early bird discount. So you can get a really nice discount on the training. And that's really for people who want to build a niche working with pregnant and postpartum students, or a roster of private clients, or find that they teach a lot of pregnant and postpartum students. But if you are a yoga teacher or practitioner who simply wants to learn best practices and have some techniques to draw from for your yoga classes that aren't prenatal yoga, this webinar will give you a lot of empowering information around that. And November 15th, I'll be coming back with beYogi to host a webinar on adapting yoga for the postpartum period. So I would love to see you then as well. A little bit about my approach to prenatal yoga. So there's so many different styles of yoga. There's yin, there's restorative, there's hatha, there's vinyasa. Same goes for prenatal. There's many different approaches to the practice. I teach a strong prenatal yoga practice because I believe that pregnancy, birth, and also parenthood require tremendous strength and stamina. So my classes are alignment-based, slow vinyasa with prenatal modifications. I teach every prenatal class with 3 goals in mind. So my first goal is to help my students to feel as comfortable as they can in this ever-changing body, to help them find greater ease, grounding, comfort. My second goal is to help prepare the nervous system to meet that birthing day, labor and delivery, with a sense of calm, with this ability to return to calm even when things feel really intense. And yoga and mindfulness are beautiful tools to help with this. And my third goal as a prenatal yoga teacher in every class that I share is to support an optimal return to postpartum wellness and leading an active life and practicing yoga. So there's some things we can practice, we'll learn about that today, but that are not optimal for supporting that return to your yoga practice on the other side. So I really look at the holistic picture from, pregnancy to childbirth to postpartum each time I share prenatal yoga. Today, I'm going to show a little presentation, some slides, and you can take notes if that helps you to catch the material and absorb. But you can also just listen and know that we will be sharing these slides with all of you. And then we'll hopefully have a little time to get on our mats and find some of these adaptations to the postures, and a little time for questions as well. And I see some questions that are coming in. I'm going to take some time to read all your amazing intros, and I know that Lizzie is answering some of them, but we're going to hold most of the questions until the very end. So Lizzie will help me at the end to moderate the Q&A just so we can keep getting through the material. Thanks for your understanding with that. I want to start the way I start a class, to sort of shift gears, ground, and open. So if you're seated in a chair, just stay where you are if that's comfortable. I'm going to go onto my yoga mat and sit on my cushion. We're just going to take a moment to breathe and ground before we start the presentation. So if you'd like to sit on the ground, join me. If you'd like to sit on your chair, just uncross your legs so that you can place the soles of your feet to the earth. Sit however is comfortable for your body today. Slide your hands down so your shoulders can soften. And then on an exhale, close your eyes. And as you pause here, feel the contact of your feet and legs to the earth. That connection to earth element, quiet, stillness. And just noticing the contact of the feet or the legs can help us drop into our roots, our grounding. And then from the legs, go up to the pelvis. Shift your pelvis forward so you restore your lumbar curve and the spine can lift and lighten upwards. Lengthen the sides of your rib cage upwards so that you mobilize that full yogi breath. Liberate your thoracic diaphragm. Feel the space you've just created for your breath. Draw the inner edges of the armpits up and out, widening through your collarbones. And then lengthen up through the back of your head. Relax your eyes, turn your gaze inward, and just start to open up your ears, that sense of curiosity, of deeper, attuned listening. And then we'll just take 5 breaths together, just in silence. I do this with my kids sometimes as a reset. Just 5 breaths, shift gears, arrive here. Let's take one more deep breath all together. And as you're ready, float your eyes open. Thanks, everybody. If you're on your mat, come on back towards the screen. Hopefully we'll have a little chance to get on our mat and move our bodies towards the end of the presentation. So let's see, I'm going to share my screen. All right, adapting yoga for pregnancy, also known as don't be scared when a pregnant student comes to your yoga class. I think so often there's this conception that pregnant people are fragile or delicate, or sometimes with new teachers, there's a hesitation to interact with pregnant students. So hopefully by the end of this webinar, you'll feel much more confident when a pregnant student walks into your class. Little background, this is a picture of me with my second pregnancy. I was in labor when I took this picture. Both of my boys were born right on their due date, which is really rare actually. I think, only 7% of pregnancies happen, the labor and delivery happens on the actual due date that they tell you. And both of mine did. So here I was just preparing to go on a walk. I took a little walk around the neighborhood, was supporting my bump when I had a contraction and pausing from my walking. But I did a couple-mile walk. It was, morning time, and I didn't really head to the birth center till later that evening around 10 p.m. Let's see. That's my kids, my almost 9-year-old Blaze and my almost 5-year-old Ray, just a couple weeks ago at the pumpkin patch. So 5 years after that picture, almost with the big belly. These are some ways that you can find me. So I know I can already see there's lots of great questions in the chat. If we don't get to everything, you can email me. You can send me a DM on Instagram if you're interested in this kind of content. I'll be sharing a lot about prenatal yoga in the weeks to come leading up to my teacher training. So follow me at Lily Dwyer Begg. And you can head to my website and check out all my offerings. You'll get these slides, so don't worry about having to write it all down so quickly. The teacher training, the prenatal training that I lead starts December 10th. You'll be emailed this coupon code and you can combine it with my early bird rate through November 1st if that speaks to you. So in this presentation, we're going to talk about the anatomy and physiology of pregnancy, trimester by trimester, some common discomforts if we have time to get to those. And then we'll look at how we can modify in a class common contraindicated poses. And if we have time, we'll also look at some encouraged poses and movements on the mat during pregnancy. Pregnancy is a time, we used to think of it as a time, not to exercise, not to start anything new. We all know now that exercising during pregnancy is beneficial to the health of the pregnant person, but also the baby. So most pregnant folks in the US will get recommendations to go out and exercise from their care provider, whether that's a midwife or a doctor. And the most common forms of exercise that are recommended to these pregnant folks are yoga, walking, and swimming. So for that reason, you're going to see folks who've never done yoga before who hear that yoga is great for you during pregnancy that might not come to the prenatal class, and many of you have seen this, I'm sure, show up 26 weeks pregnant with a really different center of gravity and sense of balance in their bodies to their first ever yoga class. So it is important to know how to support these folks. There's many benefits to prenatal yoga or just yoga in general during pregnancy. It can reduce back pain, pelvic pain, improve mood, prep your nervous system and your stamina for the marathon of childbirth and labor and delivery, help with your postpartum recovery. It can help support a sense of community during pregnancy and also postpartum. And staying active during pregnancy can support fetal position, which can have a huge impact on your labor outcome. I share this quote because, like I said earlier, sometimes new yoga teachers are intimidated by their pregnant students, and there are high-risk pregnancies, but typically high-risk pregnancies where being active could be harmful, like people with a placenta previa or who are put on pelvic bed rest, they're not going to show up to your yoga classes. You might have older mothers showing up to your yoga class, but they're not at risk due to yoga and exercise. So they really are preparing for a peak physiological event in life, and they need the strength and the stamina of a practice. So you don't just need to tell your pregnant students to lie around on bolsters the whole class. Let's dive into the anatomy and physiology of pregnancy. This is a beautiful image of the different moments post-conception to full development of the baby in utero by Alex Gray. And the first thing I want to share is a reframe from the Ayurvedic and the yogic lens of pregnancy, that it doesn't just start when we see the positive on the pregnancy test, but it really begins in the months leading up to conception. So I get into this more in my teacher training. We study the 4 phases of the menstrual cycle. And if you have a menstrual cycle, if you are still bleeding, and you're not taking hormonal birth control pills that might suppress aspects of this cycle, you might just already notice that your mood is different, how outgoing or shy you feel, what kind of physical activity your body craves, whether that's yoga or another form of exercise, shifts, right, at these different cycles, these different phases of your cycle, I should say. And so this adapting the yoga practice for the menstrual cycle is about coming into greater balance. So we're working with and not against these fluctuations and acknowledging that there is this like cyclical nature to our bodies when we're menstruating. But for the sake of this webinar, just to say that we look at the holistic picture, not just the moment you see that positive on the pregnancy test. All right, so the first trimester is weeks 1 through 13. And remember, week 1 is before you see the positive. So week 2 around, right, that's when we ovulate typically. That would be when the egg is fertilized. But the first trimester is weeks 1 through 13. By week 13, baby's about the size of a sweet pea. And the uterus is quite amazing. It's, below your pubic bone if you're not pregnant. And then right around the end of the first, beginning of the second trimester, the uterus will kind of blossom up above the pubic bone. That's when you see more bump, more baby. And it moves from a pelvic organ to an abdominal organ. It rises all the way up under the breasts at full term before you get this dropping of baby down into the pelvis. So the first trimester as yoga teachers, it's important to know that in our culture, not everyone will share that they're pregnant in the first trimester. Up to 25% of pregnancies end in miscarriage. It's more common than we might think. And 80% of miscarriage happens in the first trimester. So a lot of people won't share with their yoga teacher that they're pregnant until maybe it feels a little more stable, that they've passed through this period where things are not so sure, where they maybe haven't heard a heartbeat yet. For that reason, if you're teaching yoga, it's helpful to say verbally, even if no one has shared that they're pregnant, to say verbally with your cues, if you are pregnant, if you could be pregnant, if you're trying to get pregnant, anything like that, right? You can skip this deep back bend. You can skip this breath retention. We'll look at what you can skip at the end of the presentation, but the idea is just to say it verbally for those people who might not have shared it because you don't know who might be early in their pregnancy. So this is the most fragile stage of pregnancy, but it's not like the yoga is going to cause the miscarriage. It's more caused by chromosomal abnormalities. So it is a fragile stage, but that is not something that the yoga practice is going to make more fragile. Let's put it that way. During this time, there's a lot of hormone changes. Your body is building the placenta, and there can be commonly nausea and fatigue. So a lot of people don't even make it to yoga in the first trimester. They might be hanging out at home on the sofa, feeling a little tired or a little sick. The hormone relaxin and progesterone are pregnancy hormones that can cause your digestive organs also to slow down. So constipation and gas and indigestion are common. You might have kind of a food belly before you have a baby bump in the first trimester because things really do slow down. So yoga can be helpful for the digestive organs. Hormones and an increase in body fluids will cause a need for frequent urination even before that third trimester when the baby is heavy and pressing on the bladder. And most of baby's organ systems are fully formed by 12 weeks. It is not recommended to do hot yoga during pregnancy, but in particular during this first trimester when these vital organ systems are being formed. So any gynecologist, obstetrician, midwife will say, avoid a sauna, a hot tub, a hot yoga. If you have a fever, take fever medicine to reduce during the first trimester in particular. So I also don't recommend hot yoga. Traditionally in Ayurveda, they don't recommend exercising to the point of excess sweat. So, a little glow and doing yoga and cultivating that natural warmth in a normal temperature room, this is good, but hot yoga is not recommended. You want to stay nice and hydrated throughout your pregnancy. The second trimester is weeks 14 to 27. By the end of week 27, baby's the size of a little head of cauliflower. And this is often considered the honeymoon phase of a pregnancy. But I have some yoga students who have said, oh gosh, don't even say that because it wasn't for me. I felt nauseous the whole time. Or, maybe most women feel better by week 14, but some it's week 20. It can be anywhere within that second trimester. So typically people start to get that glow and feel better, but not always. Movement can be detected usually by a second time mom because they know what they're feeling by 13 weeks, but it often just feels like little gas bubbles. So sometimes, you won't detect that until 16 to 20 weeks when movements become bigger from baby in utero. Blood volume increases by 40% by the end of the second trimester. It's a great time if you're feeling better. Maybe you were feeling low energy first trimester. You're going to get a lot bigger third trimester. This is the sweet spot for your pregnant yoga students to really focus on building that strength and stamina so that they have a smoother time in the third trimester and they have that stamina for birth and postpartum. So encourage them to keep coming to class. They're doing amazing. The center of gravity changes. There's the biggest growth spurts for baby in the second trimester. So just be mindful, especially with newer students, around balancing poses. You can give them a wall for support and just be mindful of that. During this time, the baby is gaining weight, drinking amniotic fluid, and releasing urine into the amniotic fluid. Every 24 hours, the fluids are replaced. And by around 28 weeks, most babies will find their final birth position. So you might feel big movements and kind of like almost cartwheel feeling movements in utero when baby is smaller. And you feel those amazing first kicks and flutters and moves. And then once baby gets into that head down and they get bigger, there's not a lot of space for big movements. So those kicks might start feeling like this and then feel more like this by the end, smaller little flutters. The third trimester is weeks 28 to 40 plus. So a low risk, healthy pregnancy can go anywhere from 38 to 42 weeks is, expected. And I like to remind people to think of it as a due week, or sorry, not a week, a due month, right? Because it's 4 weeks, a due month, not a due date. So instead of putting so much pressure on one day on the calendar that the doctor says your baby's going to be born this day, to really think like 38 to 42 weeks, you have these 4 weeks where your baby could be born. Baby is about the size of a watermelon by 40 weeks. So in this third trimester, your hips and pubic bone are changing shape. This can contribute to pelvic joint instability, tenderness. There might be swelling in the hands and feet from decreased movement, decreased hydration, increased blood volume, 50% of increase in blood volume by the third trimester. You might get these painless but tightened kind of feelings around the abdomen, the bump, the uterus. These are called Braxton Hicks contractions. They don't create cervical change, but they do tighten the uterine wall. Baby can drop with a first-time student at like 38 weeks, but it's usually later with subsequent pregnancies. So this creates less acid reflux, more space to eat and breathe, but also more pressure on the pelvic floor muscles, more of pressure in those joints and more of that pregnant waddle. Baby has all 5 senses. The bones are hardening, the hair and the nails are growing, and baby can survive outside the womb with a little support at 7 months. Just like we talked about preconception, I also want to bring this term, the fourth trimester, into our mindset. The fourth trimester is the first 3 months postpartum. And it's a really important time to acknowledge on our path as pregnant and postpartum students, or relating to our pregnant and postpartum students if you're not pregnant yourself. So the typical guideline that you'll get is for a full 90-minute vinyasa class, you wait. You don't just go back the next week. You wait 4 weeks after a vaginal and 6 weeks after a cesarean section to resume this kind of full yoga practice. And you want to get doctor's clearance. There's little things you can do. There's slight exercises, breathing. If you had a cesarean section, there's breathing down to the incision. There's things you can do, diaphragmatic breath, dynamic mula bandha, engaging the pelvic floor muscles, gentle chest openers, that you can do certain things, but not a full yoga practice until you've been cleared. You want to use caution with crunches, abdominal exercises that increase pressure in the abdomen, deep twists and back bends while you're healing and coming back in with this center that has expanded so much. We'll talk more about this on November 15th. So if you want to learn more about the fourth trimester postpartum, November 15th, 12:30, I'll be doing my Adapting Yoga for Postpartum webinar, and I'd love to see you there. You want to emphasize poses to open the chest and shoulders, because holding a little one and feeding a little one and all this can just cause a lot of medial rotation of the shoulders, shortening and tightening in the pec and in the anterior delt space here. So like your fish pose, upper back strengthening, stuff like that can feel great after you've been cleared for exercise. At this point, baby loves skin to skin contact, and it doesn't have to just be the person who gave birth to baby. It's like, the dad can do skin to skin, partner can do skin to skin. It stimulates the flow of oxytocin, this like love and bonding hormone. It's a beautiful soothing tool to use with a baby. Babies love to be sung to. Even if the parents don't think their voices are beautiful, babies will always think that their voices are the most beautiful in the world. So if you want to chant, if you have a chanting practice, or just sing, it's grounding for everybody. It helps downshift the nervous system for both babies and parents in the wee hours of the night. So I'm not going to get much into this today, just for the sake of time. I do want to acknowledge that up to 50% of first-time moms have postpartum depression. It's more common than we acknowledge in our culture. So it's out of our scope of practice to treat, to diagnose postpartum depression. But I think to have an awareness of what it is, it's this imbalance, maybe caused by sleep deprivation or caused by hormonal fluctuations, among other things, even in folks who've never had depression before. We often think of the time with your newborn as such a happy time, but it's not for everyone. There can be thoughts of harming yourself or harming your baby. And so knowing what this is and when to recommend somebody get support, whether that's a student or a loved one, I just want to shine a little light on this topic. All right, here's a picture. It's kind of amazing, right? Here's a picture of how the growing baby makes room by moving all the guts and the organs, and pressing down on the bladder and moving the thoracic diaphragm and the lungs up. Yeah, so you can just kind of take a look and see all these shifts. You can even see the milk ducts coming in this picture. There's a brand new organ. It's the placenta. It's as big as a dinner plate. So in the first trimester, you're growing a new organ, which is just amazing. Our bodies are so amazing, as you all know as yoga teachers. But yeah, not much room for that bladder when a baby is 40 weeks. This is from ACOG. This is like typical weight gain during pregnancy. And I share this slide just because it's interesting, I think, to see where the weight is. Maybe it's not all where we thought it would be, but also to say that everyone gains a different number. If you are very underweight, on the thinner side to begin, you might gain more. And if you are larger, you might gain less. So the 30 pounds is sort of like average, but I hate to see people putting this pressure on themselves to gain no more than 30 pounds. We're all starting from a different set point. And I think as yoga teachers, we can do a lot to create a body positive environment in the way that we use language when we're teaching yoga. This picture shows the fundus, and the fundus is the top of the uterus, right? So at 5 months or 20 weeks pregnant, the fundus is about the same height as your belly button. And then the uterus, I said, like earlier, I mentioned it grows from like a pelvic organ to an abdominal organ. It's going to rise all the way up under your chest by full term before you get a little more breathing room when baby drops. Ina May Gaskin is a famous American midwife, and I love this quote by her. She says, "There is no other organ quite like the uterus. If men had such an organ, they would brag about it, and so should we." The uterus increases 20 times its initial weight and 1,000 times its initial capacity. And then within that 4 to 6 week period postpartum, goes back to its pre-pregnancy size. So it's just pretty amazing. Before we get into these next slides, and I'm going to go quick through them, we get into more detail with this in my training. These are slides that show some common discomforts that your students might bring up when they're pregnant. I want to just touch on the scope of practice topic. So as yoga teachers, it is outside of our scope of practice to diagnose or treat any of these conditions. But I want you to be aware of them because your students might talk to you about them. They might already know from a PT or their doc that they have this thing going on. And it's helpful to know what kind of yoga poses can support these people, but not to diagnose anyone with any of these conditions. I think it also, to talk about these common pregnancy discomforts, gives us more compassion to relate to what these students might be feeling in their bodies. So I'm going to go quickly through these. Lumbar lordosis is here's my pelvic model. So it's the anterior tilting of your pelvis. I'm going to stand up and show what that is. So here's my pelvis, anteriorly tilt, right? It's an anterior tilt of the pelvis. This is what I'm sitting on, my birth ball. It's an anterior tilt in your pelvis and a movement of the lumbar spine in towards your abdomen, your front body. So obviously, as a baby gets bigger, this is going to happen. It can also be caused by weak abdominals and tight hip flexors. So learning how to practice what I call a core conscious breath, where we exhale and hug in towards the midline, not just suck in the navel to the spine, but hug in the two front hip points in towards your middle. This is like your deep transverse abdominis. This can support your lower back. This can help with lumbar lordosis. Also poses like child's pose, spinal balance pose, even like trikonasana triangle pose, if it's done correctly, can support that elongation of the lower back if a student is having excessive lordosis because of pregnancy. The sciatic nerve is the biggest nerve in the body. It's like the thickest nerve, I should say. It's about as big as one of your fingers. And it moves from the sacrum down through the back of the legs. So in about 15% of the population, our piriformis muscle in our deep hip squeezes around that sciatic nerve and can cause a compression. As pregnancy causes gait changes, we walk differently, we stand differently, or even just the growing weight of baby pressing on the sciatic nerve, folks can get sciatica even if they've never had it before. So internal rotation and flexion can help with sciatica. Pigeon pose, if it's that piriformis, gripping onto it can help with sciatica. Round ligament is this ligament that tethers the uterus to the pelvis. And as the uterus rises, it has to thin and stretch. So this round ligament pain, it's this kind of electric pain, or sometimes a stabbing pain, a sudden pain, ache, a nag that doesn't go away. It can feel different ways for different people. But it's like in this picture, it's in that kind of groin region, top of the thigh, bottom of the bump region. The hormone relaxin is thought of as a pregnancy hormone. However, recent research has shown it's actually not just a pregnancy hormone. It's present in sperm. So it's responsible for the motility, I think it's called, the ability of sperm to swim and move. And it's also responsible, it comes into your body during menstruation. So if you menstruate and you're not on hormonal birth control pill, you might notice that when you menstruate, you are a little more flexible. If you practice yoga every day, you might notice this. Yeah? You might also notice that you take your favorite yoga class, but when you're during your menstruation phase of your cycle, you get a little crick in your neck, or your SI joint gets a little achy afterwards. This is the joint laxity. Relaxin softens the connective tissue and joint space, the ligaments, and it affects the whole body. So the reason relaxin is a pregnancy hormone is it's intended to help us with opening the pelvis, making way for baby during pregnancy and then childbirth. But it also affects the whole body system wide. So you can feel this kind of ache in your neck and your shoulder, all over. For that reason, we don't do a lot of deep stretching with our pregnant students. We want to focus mainly on stability and integration, on hugging muscle to bone and creating the right conditions for joint stability. So it can be higher in women who are having twins and triplets. It can be higher in some women than others. It stays in your body while breastfeeding also. Some common places where you might feel tenderness in the pelvic joints include the symphysis pubis. Can you see? I know it's a small picture of me right now because of the slides, but I'm bringing my pelvic model very close so you can see. In between these two bones, there's a pad of cartilage, right? So the pubis symphysis is not just bones, it's bones meeting cartilage. Do you see? Yeah. And so when you're pregnant, as that softens, it can have a diastasis or a splitting apart, and it can also become a little offset. And this is very painful. It can feel like someone punched you in the pubic bone, right in the, right in the front of your pelvis here. Another place where people can feel ache is the sacroiliac joint, the space where the sacrum and the ilium meet back here. Also, tailbone pain is not uncommon during pregnancy. But like I mentioned, relaxing can also affect the entire body. The vena cava is a large blood vein that carries blood in the pregnant person. So this is vena cava syndrome of the pregnant person, not the baby, from the lower body to the heart. And as the weight of baby, amniotic fluids, placenta gets heavier, when you're lying flat on your back, it can put pressure on the vena cava, on this venous return to your heart. And it can cause your palms to get clammy. It can cause you to feel dizzy or woozy or unwell. And that's why we don't do Shavasana on the back at a certain point around the second trimester. So I want to just talk about this because one of the questions I always get is, what about bridge pose? What about Vishnu's couch, Anantasana? What about, people ask, what about all these poses? Fish pose. Yes, you're on your back in fish pose, in bridge pose, but you're not flat on your back. So if you want to teach a pregnant student a pose like happy baby pose, which I would definitely recommend you teach your pregnant students, and the reason why I would recommend it is it stretches your pelvic floor muscles. And you need to not just have a strong pelvic floor, but a flexible pelvic floor for vaginal childbirth. So you can do happy baby for like 5 breaths and it probably won't be a big deal. But if you want to stay there and breathe and work into it, you can just put a little prop under them, like put a bolster under them, make a letter T with a couple of bolsters, or put blocks under the head and the upper back. And if they're at an incline, the vena cava won't be compressed. You can roll to either side. It used to be that you could only roll to the left, but now research shows roll to the right, roll to the left. Just don't be flat on your back, right? So you can you can roll. Usually in yoga tradition, we're on the left side, the lunar side for Shavasana during pregnancy, but really you could be on either side from a medical perspective, I should say. So there's that vena cava on the right side. Diastasis recti is a normal occurring separation of the rectus abdominis, the two six-pack muscles. Now, your abdomen, your front core, is composed of the rectus abdominis, which is the most superficial, towards the skin level of muscle, internal and external obliques, and then deep under the transverse abdominis. So I talked about hugging baby when we breathe, when we exhale. You can almost imagine like if you were wearing a pair of sweatpants and cinching a drawstring from hip point to hip point as you exhale. That is your transverse abdominis, that action. Even if you pretend to cough and you feel how it draws in, okay, that's your transverse abdominis. So that's the deepest layer. On the surface, as baby grows, the two sides of the six-pack will give a little bit and we'll have a thinning and a stretching, diastasis. This is normal. Most pregnant people have a diastasis. It's considered an injury-based diastasis if it remains past that 4th trimester. So it's measured in terms of how wide it is. How many fingers can you fit? So I'm going to roll down and show how many fingers can you fit all along this line from the xiphoid process to the pubis, how wide it is. It can be 5 fingers, 4 fingers, 2 fingers. Anything more than a finger and a half is a diastasis. But it's also measured in terms of depth. Is there a firm end point when you press in? So imagine this is my abdomen, when you press in with your fingers, or does it feel really soft and give quite a bit? Yeah, so we're looking for both width and depth Again, we're not diagnosing this, but I'm sharing this information so you know what it is. This is how it would look. It can look like this when you're passive, when you're doing a sit-up or a plank or a crunch. It can look like a little mohawk or a coning, a little loaf of bread that protrudes down that midline where the linea alba, that strip of connective tissue is. So, what to avoid? Yeah, let's talk about that. And we'll get more into diastasis recti if this is interesting to you on November 15th. Yeah, when we do more of the postpartum adapting. But, during pregnancy, avoid deep back bends. Remember at the beginning, I said I teach keeping in mind an optimal return to an active lifestyle after you have your baby. So you can do sure, I could do a drop back into full wheel when I was pregnant, no problem, because I did that all the time before I was pregnant. However, I don't do that when I'm pregnant because I know that it will cause more of this thinning and stretching, and that area is thinning and stretching, the skin, the fascia, the muscles, it's all thinning and stretching. So you want to think with that optimal return with the holistic picture in mind. Sure, you can do boat pose, crunches, arm balances, but is this wise? Or is it going to create pressure, intra-abdominal pressure that can exacerbate a diastasis? Yeah. Acid reflux is common during pregnancy, a softening of the kind of relaxing of the valve that keeps stomach acid out of the esophagus. So keeping head and heart in line, having lots of blocks, lots of props for your pregnant students. So they might not fold forward all the way. You might get head and heart in line. Fatigue is common, and knowing when to give in to fatigue and rest versus when to keep exercising and keep going, because that helps you energize and build stamina is an important discernment to cultivate when pregnant. Headaches are common during pregnancy due to hormonal shifts, stress, metabolic shifts, fatigue. So neck stretches, restoratives, head below heart, even wrapping the eyes like in the Iyengar yoga tradition with a little pressure around the temples. These all can be helpful. Nausea is very common. Some people have it the whole pregnancy, super common in the first trimester. There's not much we can do, but there are pranayama techniques, breathing in for a count of 5, out for a count of 5, samavriti pranayama. This can just help you have a tool that you can use to get through these rough patches when you're not feeling well. And then you can call on them in labor and delivery as well. It's practice. I'm going to skip this quiz so that we can keep going, but you can take it on your own when you get the slides. Because what I want to get into now is a little bit of movement. So you are so welcome to step onto your mat. Unfortunately, I can't see you. What I can see on my screen is a picture of my talking head and then a picture of the slide. So I would love to adjust and see your postures, but let's keep going and I'll show. I think seeing the slide will be more valuable for you all. And if you want to watch the slides, awesome. If you want to get on your mat and do the poses, equally awesome. So do what feels right for you. The first posture in a vinyasa class or a flow class to avoid is sit-ups, boat pose, crunches, poses that contract the rectus abdominis and create abdominal pressure, intra-abdominal pressure, where you might see the belly pop up like you do when you do a sit-up. So here I've put my gorgeous ball. This is one of my favorite props for postnatal yoga. You can use it to massage and work around C-section scar tissue once that scar has healed a bit. You can use it to learn proper breathing techniques. You can use it for core work. So I'm not really pregnant in these pics, as you can probably tell, but I've just put this under my shirt. If you were teaching boat pose to a student, you could, and if you want to do it right now, come onto your mat, find your way to all fours. If you have a gorgeous ball, you could squeeze it in between your inner thighs. If you don't have a gorgeous ball, squeeze a block, middle or narrow width in between your inner thighs. All fours. Now, you're not doing a cat or a cow pose, but you're doing what I call a core conscious breath. So without rounding the spine, as you exhale, you can even purse your lips and blow out through your lips. Can you think of hugging in from the two front hip points towards your midline. If you're pregnant, as I know some of you are, you will feel this amazing superpower of an ability to kind of lift your bump up towards your spine. And it feels so good to get that support for your low back. So that's core conscious breath on all fours. It teaches your pregnant students to activate the deepest layer of the abdominal core, the transverse abdominis. This is your pushing muscle. This is a smart thing to learn to use. It's also going to help with your recovery postpartum. A lot of us have only been trained in the art of sit-ups and crunches and boat pose. And so getting to these deeper core muscles can transform your press handstands, your inversions off the wall, your ability to support yourself, and this foundation of the deep core canister, pelvic floor, transverse abdominis, thoracic diaphragm, pelvic floor, and then transverse abdominis in the front and multifidus in the back. This forms this powerful, deep layer of your core. And doing these exercises while pregnant help you to find them postpartum as well. Okay, the other core exercise I show here is a wall squat. So I've got my whole back up against the wall from sacrum to skull, scapula, sacrum on the wall. You could squeeze a Courgeous ball or a block. Now the block can go this way or this way, just depending on what works with your anatomy. If you have stronger quadriceps, more tissue there, you might want to go narrow. If you have more of a gap between your inner thighs, you might want to go middle. But you're squeezing the block as you exhale and hugging in around baby, around the bump, sides of the belly drawing in with each exhale. So to come out of that, you would press your palms into the wall and lift away from the wall. Here's another option with your core work. It's spinal balance pose, which you might even teach in your vinyasa yoga class or your non-prenatal class. This is a pose that's great for both strengthening the back as well as the front core. I would not recommend it for any students that have a pelvic joint pain, like a pubis, symphysis pubis, this little pad here of cartilage. Pain or discomfort, because this kind of asymmetrical work doesn't always feel great for those students. But yeah, you have some core exercises you can now draw on. Twists, we avoid certain twists. However, it's a myth that you shouldn't twist when you're pregnant. So we avoid closed twists, right? Because there's just no space at a certain point, and we don't really want to twist the uterus. We can twist more from the bra line up when baby rises way up high. Yeah, so here's an example of an open variation of this seated twist. You could teach this for your pregnant students when you're teaching a closed twist. Utkatasana, revolved Utkatasana could become Malasana. And if you want to try this on your mat, please feel free. Now, if you're in Malasana and your heels are popping up, number one, wider stance. Number two, externally rotate your femurs more. And then as a last resort, tuck a little wedge like a blanket or a mat that's rolled under your heels. But first, try number one and number two, because those will often resolve and you don't have to jump to the biggest intervention of a blanket always. Yeah, wider, externally rotated, then blanket. Okay. Another option on a twist. This is my favorite, and I would not recommend it if there was acid reflux because the head is below the heart. But this twist just feels great, and you can do it all the way up to 40 weeks. I've gone into the deepening version of this pose, right? But you could even do it with your right hand threading through to the left and with your left hand off to the left side of your mat. So you don't have to walk your hand forward or pick up your knee or any of that unless it feels great. If you're doing this, please make sure to do both sides. Your body will thank you. Here's another twist. So there's this myth, right, that we shouldn't twist when we're pregnant, but twisting in the Iyengar yoga tradition, in the book Iyengar Yoga for Motherhood, the kind of Bible of prenatal yoga, they say twists increase blood flow to the kidneys and twists improve bladder function, two things that are really important during pregnancy. So do twist. Yeah, that's a myth. We can get rid of it. But be wise in how you twist, right? You might not do Parivrita Parshva Konasana, revolved side angle, but look, I'm in lizard. I've opened, externally rotated my left leg. I've walked my right hand off to the side. I'm rooting into it, and there's space for thoracic rotation in lizard. So your students don't just have to do these open, like you don't have to put them in side angle when everyone else is doing revolved side angle, because those are really different concepts in the body. They can do the same thing, but modify to make space for baby. Of course, at a certain point, it's just not going to be comfortable to lie on your belly. Like that's based on comfort. Whenever your student says not anymore, that's the time to stop. Okay, there's not like a hard and fast rule around that. But look, you could do locust as a standing pose. If they can't interlace their hands, hands to hips, tack the elbows in and back, or hold a strap. So standing locust. Postures to avoid include deep back bends. So these could also thin and stretch the abdominal tissue, and that could, cause a more likely diastasis recti. So if you want to give this one a try, if you have props at home, you can put 2 blocks on either side of your ankles and a bolster over your thigh, or your, not thighs, your calves. You could have your hands on the bolster on your low back or on your blocks. And you'll see that with this lift, you don't have to press the pubis forward as far. We will not do Urdhva Dhanurasana in my prenatal yoga classes. And if I have a pregnant student, I'll encourage them to stick with bridge. And another great modification in bridge, even if they have pubis symphysis pain, squeeze into a block. Get those adductors to strengthen. That can help with that symphysis pubis pain. Or if they have the sacroiliac joint pain, strap around the thighs just above the knees and press out into the strap. Activate your glutes, and that can help stabilize if there's SI joint pain. So bridge is a much more gentle back bend, opening the chest without thinning and stretching the abdomen. I would not recommend Urdhva Dhanurasana, upright bow, or full wheel, or whatever you would like to call this pose when pregnant. You can't really lie down on your belly, but you could do sunbird, opposite hand to ankle. Again, I wouldn't recommend this for folks with pelvic joint pain. You don't hold the breath during pregnancy. So if you're teaching a class with a breath retention, you can say, for those people that aren't sharing in the first trimester, we're going to do a breath retention if you are trying to get pregnant. If you might be pregnant, you're going to breathe deeply down to your belly and allow your abdomen to expand as you inhale and relax back towards your spine as you exhale. This is called diaphragmatic breath. And it stretches the pelvic floor muscles and mobilizes the thoracic diaphragm and deeply calms your nervous system, returning you to that state of rest and digest. In general, we don't do a lot of activating, breath of fire, holding the breath, Bastrika, pranayama, the bellows breathing. We do more cooling, calming, downshifting breaths or even breaths during pregnancy. We don't jump our feet apart in prenatal yoga. This is a common thing in Ashtanga yoga and some vinyasa classes. So rather than doing this, right, with all the softening of the connective tissue around the pelvis, we would heel toe the feet apart more like this. Yeah, so just to know these kind of simple cues that make sense for pregnant students when you're cueing, jump to the long edge of your mat if you cue that in your class. Not a good time to start learning to get upside down. So if you have a practice of headstand, you can continue when you're pregnant at a wall. If you have a practice of handstand, you can continue at a wall. I would not recommend holding an inversion forever past 35 weeks. However, if your baby is breech, inversions can help turn a breech baby. If you want to know more about this, check out the website Spinning Babies. The midwife Gail Tooley has a lot of free resources around supporting optimal fetal position. And you'll see some of her yogic inversions that she shares to support helping to flip a breech. So here's my handstand when I'm not pregnant, and here's my at the wall modified wider stance prenatal headstand. In the training, we teach how to get up into this shape with a wider stance and all that, but you can do a headstand if you're pregnant. It just might look a little different. We also avoid deep flexibility work because of relaxin hormone. So here I'm in half splits, I'm pushing into my heel. And if you're trying this with me, press down into the heel. Yeah, press into the heel so your leg is not just resting on the ground, but feel as you press down how your upper hamstring tones and engages. You are stabilizing around the joint space. And that's a smart way to practice at all times, but especially pregnancy. Lastly, we avoid lying flat on the back because of the vena cava syndrome. So just putting a little prop under your pregnant students, have them grab all the blocks, however many they need. I'm in supported fish pose here with internal rotation of my femur. Here I'm in a left side lie. This is a great prenatal shavasana. If you want to try it, you lie on your left, you take your top leg, so it's your right leg on your left, over the top, and you can rest it on a bolster. You can also put a blanket under your waist so that all the weight doesn't drop into the left hip. Yeah, so the blanket pads your waist so that it's also supported. And then you can also put a bolster or a pillow under your head. So I'll stop here, but I will share with you all of the slides from this presentation. And there's a few more around poses that I highly recommend during pregnancy. But I don't want to take much more of your time. I see Lizzie is back. Hi, Lizzie.
Hey, how are you? Well, that was an amazing topic. I'm so glad we were able to have you on, and
Thanks.
I think everyone is excited to see those slides and look more into this. Like we mentioned, make sure to check out Lily's upcoming yoga teacher training. We have that exclusive discount, and I'll put that link specifically into the email we'll be sending later today with the recording. So make sure to check that out and click that link so you can learn more. We don't have time for the questions that were answered. Or the questions that were asked. So I will take a look at it and send them to Lily if they were not answered in the webinar. But thank you again so much, Lily, for joining us in this BOGI webinar series. I think I'm excited for the next one. And just so everyone knows, we'll start to promote it, but we have an upcoming webinar, which Lily had mentioned starts, it'll be a live event similar to this on 11/15 at 1 p.m. Eastern. Lily, did you want to give a quick little brief intro to that?
Sure. So very similar to this webinar, but around the postpartum period. So we'll learn some best practices, and I'll be sharing a bit of this program I've created called Reclaim Your Center. So when I mentioned the deep core, we will be learning how to activate and where these muscles are. If you are postpartum, awesome. If you want to support postpartum students, this webinar is for you. If you want to learn how to enliven your deep core for press handstand and advanced posture work, even if you've never had a baby and are not planning on it, come, because it's going to change how you get into your inversions.
Amazing. Alrighty, everyone. Enjoy the rest of your day, and we will see you on the next one. Thanks, Lily.
Thanks so much. Thanks so much, everybody. Pleasure to be here.
Bye.
Bye.